Today's presentation is by Erica Miller. Erica is the Director of Training for DL Newslow and Associates, a 20-year veteran training, auditing, and consulting firm based in Orlando, Florida. Erica also consults with clients to design and implement food safety management systems that are compliant with the standard of the client's choice, and writes articles for various food safety publications and the company blog. Take it away, Erica.
Thank you so much, Jane. Hi, I'm Erica Miller, and today I will be talking to you about FSMA, or the Food Safety Modernization Act. You've probably heard about this before, but today I would like to take you through FSMA compliance from a common sense perspective, using scenarios that I've encountered with my clients and common questions that I get in the trainings that we hold. So the first question is, what is the Food Safety Modernization Act, or FSMA? The first thing to know is that the Food Safety Modernization Act is a regulation which was signed in 2011 in the United States. It is a Food and Drug Administration, or FDA, regulation. So any food that is regulated by the USDA is completely exempt. So if you are sending meat or poultry or eggs that have already been taken out of the shell to the United States, you have nothing to worry about. The regulatory landscape for those products has not changed at all. Similarly, FDA regulated foods that already had HACCP requirements, like 100% juice and seafood, are not subject to most of the regulations that we will discuss today. Your regulatory landscape has not changed much at all for those products either. So it can be very confusing, especially for international audiences, to understand what this law means and what they need to do to be compliant and to continue to provide food to the United States without interruption. So when people say FSMA, or the Food Safety Modernization Act, they typically are thinking of the Preventive Controls Regulation, which is the regulation which applies to food manufacturers and processors and warehouses and distribution centers. Actually, this act is made up of 7 different regulations, many of which people are not even aware of. So we will go through them all briefly, and we will explain a little bit about each one. The first step for any company is to figure out which regulations would apply to them. There are a lot of misconceptions about which regulations apply. So again, we'll go through that quickly today to hopefully clarify some common questions that we hear. Another thing to keep in mind is that companies are responsible for ensuring that their suppliers are compliant as well. So if you are a company that is intending to export food to the United States, you also need to ensure that your suppliers are offering a similar level of public health protection. So the FDA considers that for food to be safe, it needs to, at a minimum, offer an equivalent level of US public health protection as if that food was being manufactured here in the US. So even if your HACCP plan or food safety plan isn't 100% FSMA perfect, if you're offering an equivalent level of public health protection, that is acceptable. So again, we'll talk a little bit about that as we go through. So the regulations that most people think of when they say FSMA are the preventive controls regulations. There's actually 2 of them. One for human food and one for food for animals, and that includes both pet food and livestock feed. So these are the regulations that apply to companies that manufacture, process, pack, or hold food, any food intended for consumption in the United States. So it doesn't matter where in the world you're located. If the food you are making is intended for consumption in the United States, then you're subject to potential FDA regulation and inspection. This really kicked off in 2002 with the advent of the bioterrorism registration number system. Companies wishing to place food into the United States have to register with the FDA. And in doing so, that basically puts you on a list for inspection. We have lots of international clients that have been on the receiving end of inspections recently. And they're not always preventive controls inspections. They have increased the inspection frequency for other regulations as well. So juice companies, seafood companies, I have heard of an increased inspection frequency across the board in recent months. So a lot of people are aware of these rules. A lot of people have taken training to become a PCQI, which is an acronym that stands for Preventive Controls Qualified Individuals. So under this rule, each facility needs to have a PCQI. They don't necessarily need to be an employee of the facility, but they need to be contracted. So it could be a consultant or someone external, but you do need to have a PCQI at your disposal. So there is an accredited course, which is set up by the FSPCA, and that course is offered throughout the world. DL Newslow and Associates, my company, we do offer this accredited course as well. And so we've trained lots of people to be PCQIs, and we've found that there's generally a very high rate of awareness around these regulations. One thing we did find recently is related to pet food. Companies that are manufacturing canned pet food, so specifically a low acid canned food type of product, they are subject to both the low acid canned food regulations and the preventive controls regulations. The reason being they are subject to LACF rules for microbiological hazards and chemical and the preventive controls rules for chemical and physical hazards. So these companies actually need to have essentially two complementary food safety plans. So what happens is the companies need to have people who've attended better process school for the canning side, and they also need to have PCQIs on the preventive control side. So it's actually two types of training. So we did find recently that there is some confusion about those particular types of companies needing to have both types of training. So I've also included on this slide the regulatory references for those regulations. So if you have any questions, you can Google those and they do pop right up, which is very convenient. The next rule that is, again, there's a pretty high rate of awareness around the produce safety rule. So these are the standards for the safe growing, harvesting, packing, and holding of produce for human consumption. So this rule applies to farms, and the word farm is defined very specifically in the regulation. Of course it is, as we think of a farm, a place where you grow crops and you harvest crops, but there's also certain activities that can be done on the farm, like dehydrating or chopping, mixing, and some of these are considered fairly low risk activities, and even if you're doing those processes, you can still be a farm, quote unquote, and regulated under the produce safety rule. So there is some enforcement discretion, and we will talk about that a little bit later in the presentation, so that you can decide, does this rule apply to me, or would I be a processor under the preventive controls rules? So this rule can definitely apply to international farms. There have been, in the United States, many recalls recently that have been traced back to farm activities, primarily water safety. There have been a huge romaine lettuce recall. There was a big strawberry recall, actually several romaine lettuce recalls that were all traced back to E. coli from the water on the farm. So the produce safety rule has 6 different subparts. So water quality is the biggest one, and it is the one that has the most controversy. So there has been a lot of discussion around this part of the rule, because farmers have pushed back and said that it's very difficult for them to do the amount of testing that's required by the rule and to do it in the way that's required by the rule. So the FDA has gone back to the drawing board, and they are looking at allowing different testing types, different methods, validated methods, so increase the number of labs that are able to do acceptable testing to hopefully reduce the burden on farmers that have to contract for this work. But in addition to water quality, you also have to worry about biological soil amendments. So many people internationally will compost or fertilize with manure, and that's not strictly outlawed, but you do have to compost it properly. And the law is very specific about exactly how that composting has to be done, and there do need to be records around that. So traditionally, farms don't keep a whole lot of records, and that's one of the things that I think is really different now, is that farms are expected to start keeping a lot of written records and providing those upon request. So it's been a little bit of an adjustment period. Most of the big farms were already doing this, but the small to mid-sized farms have struggled with compliance. There's a specific subpart about sprouts, because sprouts have, again, been associated with a lot of outbreaks in the past. Their life cycle is so short that by the time the sprouts have, by the time anyone's figured out there's a foodborne illness issue with sprouts, they've already been consumed. So domesticated and wild animals, so whether there are domesticated animals living on the farm or wild animals encroaching on the farm, that is addressed. Worker training, health and hygiene is addressed. So even if you are using migrant farm workers, those workers need to be trained in their preferred language. And finally, equipment, tools, and buildings, again, are addressed in the regulation. So it's been quite an adjustment period, especially for the small to mid-sized farms. I will say that I have encountered a lot of confusion from farmers who feel there is not a lot of information out there if they're exempt from the rule. So I recently did a job where I actually traveled to a rice farm and visited with the people there because their customer was concerned about produce safety rule compliance. The rice farm is exempt. Anyone making raw like grains, so rice, oats, wheat, corn, they're all exempt under what's called the rack exemption. And that's not new, but again, people aren't really clear about who's subject and who's not. Also, if you're producing produce that is not typically eaten raw, so things like potatoes, for example, that are not typically eaten raw, those farms are also going to be exempt from this rule. So it doesn't apply to all farms. And again, people get very confused about what do I need to do? So if you're not sure whether or not the rules apply, the FDA has a fantastic resource now called the Technical Assistance Network, and I've included a link later in the presentation, so we will see that as we go through. The one I would say, the rule with the most confusion internationally would be the Foreign Supplier Verification Programs, or FSVP rule. So this rule applies to importers of food into the United States. I think people see foreign supplier in the name and they think, oh, I'm international, I'm supplying food to the US, this applies to me. Actually, this applies to importers, and the importers have to be located in the United States. Physically, they have to have a brick and mortar location in the United States. So even though the name of the regulation has foreign supplier in the name, it doesn't apply to foreign suppliers, it applies to importers only, and those importers have to be located within the US. So this is one of the most common misconceptions that I find. And the training, although there is an FSPCA course available for this rule, I have noticed that it is not mandatory, so nowhere near as many people are attending as attended the PCQI training. When people attend is when the FDA has come to their facility and has asked them for their FSVP, and they don't really know what they're expected to have, or they're very confused. Then they will typically be given a warning, a 483, and said, hey, you need to go take a training class so that you can understand better what's being expected of you. I will say that's very different than previous years. The FDA used to be much more focused on enforcement, and now education is really the focus right now. So this rule states that the importer of the food, whoever is actually located in the US and is doing that importing, is responsible for ensuring the safety of that food. And it's really a desk audit based thing. You must ensure that your supplier has a food safety plan that is, again, offering an equivalent level of public health protection as if they were located here in the United States. So some people think, oh my goodness, the hubris of those Americans, you know, you all think that you have the best food safety systems in the world, and that's not true at all. We certainly do not have the most robust or the best food safety systems in the world. That's just the minimum. That's just the bare minimum we require. We actually recognize that many countries, you know, New Zealand, Australia, Canada, namely, have equivalent or even superior food safety systems in many cases. And those countries have been recognized as having equivalent systems. So if you're buying food that has been manufactured in Canada, Australia, or New Zealand, then all you have to do is ensure that your supplier is in good standing with the relevant food safety authority in that country. So say you're buying something from Canada, it's manufactured in Canada, you would just ensure that the food you're buying is subject to regulation by CFIA, the Canadian Food Inspection Agency, and that your supplier is in good standing with that agency as well. So that does make it a little bit easier. One of the most confusing parts about this regulation is this role, this new role that's been created that's called importer, okay? And the reason it's really confusing is because importer of record is not new. Importer of record is something that has been in place for a very long time. Now they created this new rule that's called importer. And many times when, for example, a customs broker is filling out import paperwork, they fill out importer of record at the top. Hey, that's me. I'm the IOR. I'm acting on behalf of my client. And then they get through the paperwork. It's electronic filing a little bit further. And there's a second field for importer. It doesn't say FSVP importer. It doesn't say food safety importer. It just says importer. So often these brokers say, oh, I'm the importer of record. That's me. And they put their name in there. Reality, it's not generally the broker. The broker could be the importer for food safety purposes, but as a general rule, they're usually not. Generally, it's the destination, wherever that food is going to actually be manufactured or processed. They typically keep the food safety paperwork. So a lot of times the importer of record and the quote unquote importer are not going to be the same entity. And there's a lot of confusion. I have personally assisted clients with several FSVP investigations that have been triggered by broker error. And it wasn't the broker's fault necessarily. They thought they were doing the right thing. They just filled out the paperwork incorrectly. When you do these customs filings, everything is done with codes and it's very confusing. And in previous years, prior to this law being in place, once the customs broker got the food into the US, their job was done. And so for a while, it still had that perception that, okay, your food got into the US, our job is done, we did everything right. But the way that the enforcement works on this rule is that the food will already have entered the country, and then the FDA says, hey, this line item that came in last week or last month, we need to see the FSVP, the Foreign Supplier Verification Program, for that particular line item of food. So they'll walk into a broker or a distributor who maybe brings in thousands of different types of food into the country. And they say, hey, where's your FSVP for this one particular line item? And the broker goes, oh my gosh, I don't know what you're talking about. I don't have one. In reality, it's probably the broker's customer that has the FSVP. The broker's customer probably has all of the documentation related to the safety of that ingredient. But again, they don't really know yet 100% how this rule works. And we're all learning together. The FDA is learning, trainers are learning, importers are learning, and suppliers are learning. So it's definitely still in the educational phase at this point. I would say that there's probably more confusion related to this rule than others. Some of the things that have really disappointed people are that you can't keep secret where you're buying food anymore. So some brokers used to make money by aggregating product. You know, they'd say, hey, I can get a great price. You just buy from me and I get it wherever I get it and you don't worry about it. Unfortunately, with the new focus on farm to fork transparency and traceability, that's no longer acceptable. And the brokers cannot hide where they're getting the food. So that's really not making a lot of people happy because they feel they're being regulated out of existence. They're no longer able to be profitable. And to those people, I would say we've had a few brokers that have come through our programs that have decided that since they can no longer keep it a secret, they are going to try to bring value another way. And they're going to act as the importer for FSVP purposes for their clients. So their clients don't have to worry about keeping all that paperwork. They don't have to worry about having an FDA investigation related to this rule. The broker says, I will handle this for you. I'll gather all the paperwork. I'll keep everything together. But that's really only been a few people that we've seen so far. So for those brokers who are worried about how this may affect their bottom line, I would say you may have to get creative and find a way to bring value a different way nowadays. Another regulation, the sanitary transportation of human and animal food, this one only applies within the United States, and it only applies to over-the-road transport. So that means trucks and rails. It does not apply for anything shipped by air or by sea. So that was, I believe, just kind of a loophole in the law. I don't know that it was meant to be that way, but that's the way the regulation reads. So it also does not apply to food that is completely enclosed in its container, so food that's all packaged completely, and it does not require temperature control for safety. So if it's something like, say, crackers, you know, the crackers are shipped in a wrapper, which is in a box, which is in a secondary box, which is in an overwrap that's very well enclosed in its container. Those crackers do not require temperature control for safety. This rule does not apply in that case. Where it does apply is when maybe you're shipping produce and you have bins and the bins are open on the top. Then it would apply because that food is not completely enclosed by its container. Another scenario would be shipping cheese or, something else that requires temperature control for safety. In that case, then this rule would apply. So international companies, if you're sending food to the US, this could be important. It depends on the terms of your shipment, because depending on the terms you've worked out with your customer, the actual ownership of the food can change hands at different times. Sometimes, ideally the customer would like it not to become theirs until it hits their dock. In that case, if you're arranging all the shipping and you're not giving over ownership of that product until it actually hits their dock, it's possible that you may have a leg of transportation that is going to be subject to this rule. We're not really sure how enforcement is going to look at this stage. In the United States, the FDA, they don't have the cars, with the bubble lights where they can pull trucks over on the side of the road. So we have heard that they have been sitting maybe at weigh stations and have been inspecting trucks as they go through to be weighed on the highways. But again, I think they're still figuring out exactly how enforcement on this rule is going to work. So depending on the terms with your customer, it may or may not apply, again, depending on what you're shipping and how. Another rule that is getting a lot of press right now is food defense, or mitigation strategies to protect food against intentional adulteration. So anyone who's compliant to a GFSI approved food safety management system like BRC, SQF, FSSC 22000, this idea of needing a food defense plan is not new. This has been required for a while. People get this confused with food fraud all the time. So the way I try to remember it, food defense is its own standalone plan that is separate from the food safety plan. Food fraud under FDA regulations is considered part of your food safety plan. So the way a lot of people approach it is they have a food fraud plan that's managed as a prerequisite program or a PRP within their program. And then the food defense plan is its own standalone thing. You need to have a threat assessment for your food defense plan. Something that is very common is that when companies do their own threat assessments, they tend to downplay the seriousness of threat. Because when we see something every day, it doesn't bother us. We think it's normal. When a professional or someone from the outside comes, it becomes really obvious that there are some major gaps in security. So unfortunately, nowadays, we have a lot of workplace shootings. We have a lot of bad things happening to people. So food, it's not even just about protecting the food. It also protects your employees and makes sure you have a very safe work environment. I was just with a client last week that said they had a little bit of a rude awakening when it came to their food defense plan. They thought they were really buttoned up, but they had let go an employee, and this employee had actually managed to come back after they had been let go and had gained access to the CEO's office. They didn't go through the front door. They had somebody hold a side door open for them because they were familiar to everyone. So in this particular facility, the production workers don't have email. So, an email goes out from HR and says, so-and-so has been terminated, but this person had worked there for many, many years. So the production folks that don't have email didn't necessarily see the message. And then unfortunately, they held the door open for this person to come in, and they made it all the way up to the CEO's office. So that was definitely a rude awakening. And I think a lot of us, we may not realize it, but we would be open to that kind of, somebody entering our facility if it was someone who was recognized or known. People snap and people kind of go off the deep end sometimes. So we absolutely recommend having a professional threat assessment performed related to this particular rule. This rule only applies to large companies, which would be defined in this instance as greater than $10 million or more per year in gross receipts. But unfortunately, small companies can be just as, or maybe even more susceptible to acts of intentional adulteration. So I would encourage everyone to really pay attention. I will say that the FDA has some fantastic resources online. There is a food defense plan builder tool available, and there is a link later in this presentation. I've found that tool to be very helpful and useful with clients who are trying to develop a more robust food defense plan. I have had it work successfully for BRC audits, SQF audits, because it's really that good. We also contract a gentleman who is a professional food defense expert and performs professional threat assessments, and that has actually been getting a lot more traction in recent years as well. Maybe even not so much because of the regulation, but because companies hear about bad things happening to other companies that do the same type of work they do, and they think, oh man, that could have been me. And the struggle is, in a situation like this, you don't know what you're going to do until it happens. You know, there was the case of in Japan, someone was going out into the parking lot and picking up all kinds of rocks and dirt and broken glass and whatever they could get their hands on in the parking lot, and they were bringing it in and putting it onto finished food. It was a chicken breast product, and the chicken breast had seasoning on it when it was finished, so it was not immediately apparent that all this, you know, extra stuff on there was rocks and dirt and whatnot. Now that person did actually end up getting some jail time because they were caught and they were prosecuted. But if that were to happen to you, a lot of people think, well, my cameras will protect me. Cameras are very reactive because in most cases, you don't have someone sitting there watching those cameras all the time. And just like the food safety laws, this is meant to be a proactive regulation. So don't really just rely on cameras because it's definitely something that we get into a false sense of security relying on our cameras. Okay, last but not least, there is a rule on third-party accreditation. What this rule establishes is what is in most cases a voluntary program for third-party audits that are accredited by the FDA. So what you would do as a company is you would say, hey, FDA, come audit me voluntarily. I want you to come look and see everything that I'm doing right. And then I can basically send food to the United States much more easily. And the reason when I say much more easily, there's two levels in the United States. From the FDA's perspective, there is appearance of violation and there's reasonable probability. And the difference is, most of the time when food is being imported into the US, all the FDA needs is appearance of violation in order to stop food. That can mean it looked at me funny, I think it smells weird, I don't like the way that box looks, I'm going to hold this. If you are a company that has undergone a voluntary accredited audit and you have signed up under the fee-based VQIP or Voluntary Qualified Importer Program, what that does is it raises you to the level of domesticated food, which is reasonable probability. The FDA can't stop and hold your food just because they think it looks funny. They have to have a reasonable probability for doing so. So this has been very interesting for our clients that send a lot of food into the US. They send products that are fairly, worth a lot of money. They are in mixed containers a lot of times, especially if you're doing LCLs, less than full container loads, and you're sending food into the US. Sometimes your food can get held because somebody else on the container has an issue. It's not even your problem, but the whole container gets put on hold, right? So it would be nice for a lot of companies to say, hey, listen, I'm tired of constantly being, paying these storage fees, paying these testing fees. I would really like a way to sort of fast track my way through customs. And that's what the VQIP program is designed to be. So that's the voluntary side. There's also the potential in the future for there to be mandatory audits. If the FDA feels that there is a certain sector of business that is causing undue amount of risk, like say, for example, we've had a lot of nasty romaine lettuce outbreaks lately. If the FDA decides, listen, we're not going to let companies that are sending romaine lettuce into the US, we just can't accept that risk right now. We're going to require that anyone who wishes to send romaine lettuce to the US has to undergo one of these accredited audits. That is now within their right to do that. They have not exercised that right yet, but it's something that could happen. So any food that's regulated by the FDA, the food, the industry, or even just the company, they can say, listen, we don't trust it, we want you to have an audit. So they haven't flexed those muscles just yet, but it is something that could happen in the future. So we definitely think there is a lot of room for companies to maybe do this voluntarily and avoid some of the unfortunate, having to be forced into it later on. So at this stage, the accreditation bodies have been approved. So ANAB-ANSI is one accreditation body that I know has been approved. They accredit a lot of the other audits that companies do, for example, SQF, BRC, as well as exams and things like that in the United States. So they've also been approved to accredit these audits. So now we're at the stage where the certification bodies are applying to the accreditation bodies to be able to do these audits. So once the certification body gets approved, then that body would need to train their auditors. So it's basically a 3-level thing: the AB, the CB, and then the auditor. So the person you would probably see at the company level would be the auditor. So once the certification bodies get approved, then they will be able to train their auditors, and then you'll be able to call these private companies and get an FDA accredited audit, which is something brand new that has never really been available before. Okay, so those are the rules. There are a lot more of them than most people realize. And so the very first step is to figure out what laws apply, because in many cases, it's not completely clear. You can be sending food into the US, like the case with my rice farmer, and none of the rules apply, okay? Rice is just completely exempt if it's not, processed into rice syrup or something like that. So in that case, that company was relieved that FSMA did not apply to them, or the produce safety rule did not apply to them, because they had felt that it was very difficult for them to get information. They had tried to ask questions, what do we need to do? And the answers were not clear. So the first step is always, okay, which laws apply to me? And which laws apply to my suppliers? Like, say I'm making a salsa product and I'm going to send this salsa into the US. Well, as a salsa manufacturer, I'm responsible for ensuring the farms that are providing my tomatoes are offering an equivalent level of US public health protection as the produce safety rule. And that includes things like water testing. So it really goes kind of deep. You have to have a pretty good understanding to be able to judge whether or not your entire supply chain is compliant. So if you are not sure, again, the link for the Technical Assistance Network is going to be coming up. They have this wonderful now online web form where you submit a question and they will answer you in writing, which is nice. The turnaround time can be a little bit long though. So if you need to know now, I would definitely recommend asking a lawyer who specializes in FDA compliance. Because under the Food, Drug, and Cosmetic Act of 1938, companies are responsible for ensuring the safety of their food. It's not the FDA's responsibility, it's the industry's responsibility to ensure the safety of food. FDA enforces that, but ultimately, as food manufacturers, we're responsible for that. So again, the FDA considers food to be safe if it is manufactured under conditions that, at a minimum, offer that same level of public health protection as US food safety regulations. And that's just the bare minimum you have to do to be compliant. You, of course, can do more. So if your supplier does not have a food safety plan that is in the format you would expect from under, the preventive controls regulation, for example, that doesn't necessarily mean you can't use them. It just means you have to look at what they do have, which maybe they have a HACCP plan, maybe they have something else, and then you have to decide, okay, does this offer the right level of public health protection, okay? So it's a lot of gray area. It's not very black and white, which is very frustrating for people. I completely understand that, but anyone who's done quality assurance for a long time, you're constantly having to make these judgment calls. And your risk tolerance and your company's risk tolerance is absolutely going to come into play here. And one of the last slides of this presentation, I have included a link to a hazards guide. That hazards guide summarizes many of the hazards the FDA is concerned about in different products. It's almost 300 pages long. It's very robust and very complete. If you are sending finished foods into the United States, I would encourage that you review that hazards guide and you determine if your supplier's plan, whatever plan they have, addresses all those hazards that are listed on that hazards guide. If so, then you're going to be pretty far along the road to ensuring FDA compliance. So that link is a little bit later on. We'll talk about that. So then I have 4 scenarios. These are all real life scenarios that I have encountered in my day-to-day work, and I wanted to include these for your reference. So the first one was, I want to send food to be consumed in the United States. What do I need to do to be compliant with FSBP? A really common question. First, you have to recognize that you're not actually subject to the FSVP regulation. You are probably subject to other regulations like preventive controls or produce safety. So what you have to do is, if you own the food as an international company, you own the food at the time it crosses the border, you have to retain the services of a U.S. agent or representative. Okay, and that U.S. agent or representative can act as the importer on your behalf, but they've got to have a brick and mortar location in the United States. Okay, so in this case, as the international company sending the food, you may need to contract a U.S. agent or representative. You may need to ensure that you're compliant with the preventive controls regulation or the produce safety regulation. Okay, but you don't really have to worry about FSVP, except that you need to understand your customer is probably going to be asking you for a lot more documents than they used to. So something that the people run into a lot is, as an importer here, they say, hey, supplier, I really need your HACCP plan and hazard analysis. And the supplier says, whoa, 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 that's confidential. I'm not sending that out to just anybody. And while I completely understand that stance, that customer's not going to be able to buy from you if you do that. And it's something we're running up against a lot right now, and companies don't know what to do. But once we move past this stage of education and we get back into enforcement, the FDA's stance is, if you can't get those documents, you don't buy it. Okay, and I understand that in industry, that's really not always how it works, that sometimes we need to buy it because it's in the right quantity, at the right price. It's the only one that can deliver me what I need. I get that. But the FDA doesn't care. Okay, they're going to say, if you can't get that food safety documentation, you don't buy it, period. And if that puts you out of business, whoop, sorry for you. So you just have to realize that your customer is probably going to ask you for documents that have in the past been considered confidential. But if you don't provide them, that's putting them in a really tough spot. So what some companies have done with great success is they have, a lot of times there's trade secret or confidential information in your HACCP plan that you're not really excited to share with everyone. Just take out the relevant parts for food safety. Take out all, remove all the trade secret stuff, remove all the confidential stuff, and make a HACCP plan and hazard analysis for public distribution. It's basically the same document. It has just removed anything that is possibly identifying, any of your trade secret processes or anything that you're concerned about. When it comes to controls for food safety, 9 times out of 10, most companies aren't doing anything really novel. If it's a beverage, we're pasteurizing it. Everybody pasteurizes at approximately the same temperature and time. A few degrees higher or lower, or a few seconds one way or the other, isn't going to be anything earth-shattering. So just recognize that probably most of the controls for food safety hazards aren't going to be, terribly secretive. So just make up a reduced version of your HACCP plan that is designed for public distribution to hopefully help with that. Okay, next scenario, HACCP plans. Several times in our classes, people have come in and have said, I already have a HACCP plan. I've had it for years. But I have been told that I need to throw it out and start over with a food safety plan because my HACCP plan is no longer a thing. And I say, no, please don't do that. Because your HACCP plan is still really important. That HACCP plan is the foundation of your food safety plan. A lot of the parts of the food safety plan are exactly the same as the HACCP plan. For example, hazard analysis. That's exactly the same. It's literally the exact same form that we've used for years and years. So you don't want to throw out a hazard analysis that you worked on very hard for a very long time and start over fresh, because you're just losing a lot of information. And if you completely throw out your HACCP plan, you're going to be losing years and years of records that show control. I would not do that. What I would do is take that HACCP plan, it's your foundation, and then you say, okay, do I need to add things? Okay, so you might need to add some additional vocabulary. Okay, this term, preventive control, that's a new term. That's an FDA term. So maybe you call everything CCPs. Maybe in your plan, you just need to say, hey, my CCPs are process preventive controls. That's what they are. Maybe you have an allergen plan. Maybe you need to look at that and you need to say, okay, do I need to elevate any parts of my allergen plan a little bit more because of the risk? And do I need to call these preventive controls? Really common misconceptions are that every food safety plan has to have preventive controls, in all the areas, so allergen, sanitation, supply chain, and process. You don't have to have one in every area. You just have to decide if you need one, okay? Another common misconception and something I've seen big companies do, I was at a conference and I heard a woman present and she said, my very large multinational company has decided that we are going to take all of our prerequisite programs, we're going to elevate every single one of these to the level of preventive control. And I would say that that is counterproductive in many cases because when everything's critical, nothing is critical. Okay, I have a client that has 17 CCPs. This client has so many CCPs that they end up with issues with their record keeping because it's just too many records to keep. It's just crazy. So similarly, if you elevated every single one of your PRPs to be a preventive control, I really feel that that's going to get you in a similar situation where when everything's crucial, nothing is crucial anymore. So you really need to sort of decide, all right, which of these are critical? Which do I need to elevate? Okay. I would definitely recommend an accredited FSPCA, PCQI, or Preventive Controls Qualified Individual class to help you make that decision. Okay, scenario 3, farms. I work with a company here that is a distributor. This company aggregates produce from many different farms and they sell it in the United States. So some of the farms, they're asking the farms, hey, I need some water testing records from your farm because I need to prove you're offering this equivalent level of US public health protection. And the farms are like, whoa, 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 I'm a little guy, I'm a mid-sized guy. You know, just because I sell my produce to you and you sell it to the US, I don't care what you do with it. You know, that's your business. I just sell it to you. Why do I have to give you all these E. coli testing records? I've never done this before in my life. Well, again, that's where you have to ensure your suppliers are compliant. So because the produce safety rule addresses water quality on the farm, this distributor is responsible for this. So they're bringing the food into the US, they're going to be the importer. They're responsible for ensuring their suppliers are offering that same level of US public health protection. Heaven forbid there's an E. coli issue in the water on that farm, that importer brings that tainted produce into the United States and there's an outbreak. Now that importer is going to be held liable. And that can be very significant. You know, in the US, we're very litigious, if you weren't aware. So, you know, one person gets sick and they hire a lawyer like, you know, Bill Marler, who's famous for this stuff. And he takes your company to court and they can really, you know, clean you out, especially if you don't have, you know, if you're not a huge company. So this is just the distributor trying to cover themselves and ensure the safety of the product that's coming from you. We have had, again, many foodborne illness outbreaks recently have been traced to crop irrigation with dirty water. The strawberry outbreak, that one really hit close to home for me because it was frozen strawberries, IQF, individually quick frozen. And it was an issue with water quality on the farms, and there was a hepatitis A outbreak on these strawberries. You know, I make smoothies all the time, and I take frozen strawberries and I put them in the blender and blend them up. I don't cook them at all. And I thought, oh my goodness, you know, if I had eaten those strawberries, I could have hepatitis A right now. That was really a wake-up call for me. So this is why these distributors are having to be so very careful. So it is, they may very well start requiring E. coli testing records for your water. Okay, last but not least, scenario 4, warehouses and distribution centers. So we have many clients who are, you know, warehouses. All they do is store finished packaged food, whether it's imported or not. Many of them have seen the FDA a lot because the FDA comes in to sample food. The FDA is not really looking at the warehouse itself. They're just sampling the food. Now, all of a sudden, these FDA investigators are coming in and they're inspecting the warehouse. And the warehouse guys are like, whoa, what kind of records are you wanting from me here? I've got bills of lading, I've got purchase orders, I've got this, you know, inventory control, traceability. But that's not what they're looking for. They are looking for temperature control records. Many, I would say most of the warehouses and distribution centers that I work with, sure, they have thermometers in their coolers and freezers. Are those thermometers calibrated? Absolutely not. Is anybody monitoring those? Absolutely not. It's very rare that I find that it happens. Or say they have a system where it puts the data to the cloud and they can pull it down later. Oh my goodness. When you ask them, hey, I need you to pull me those records, it's difficult because they've never had to do it before. And so they're like, oh my gosh, I know that the salesman told me how to do this, but I can't remember how to do it. So if you have one of those systems and you haven't tried to pull records out in a while, I would definitely try that. Just do a dry run. Like say the FDA comes in and says, hey, we need your temperature monitoring records for last week. See if you can pull those, okay? So you've got to have calibrations on your thermometers. You've got to have monitoring records. You've got to have verification. And this is all really new for these warehouses and distribution centers. You know, they've been accustomed to seeing the FDA, but only in relation to the food that gets sampled. They're not really used to being inspected related to their process. So again, that's under 21 CFR 117. It's modified requirements under that regulation. So the warehouses and distribution centers do absolutely need to comply with that. And I would say that's one of the biggest gaps that I've identified in my work are these warehouses and distribution centers. Okay, so I think many people have heard that their good manufacturing practices have been updated. So they used to be contained in 21 CFR 110, and now they've been moved to 117. 21 CFR 110 is dead and gone now, RIP 110. So now some changes that are really important. Ironically enough, allergens were not addressed as part of current good manufacturing practices prior to this. Now allergens definitely are. So you would be amazed at the misconceptions I still encounter in my work. It's something, you know, we've been really harping on allergens for a long time. For many of us, it seems really obvious. I have been in companies recently where they said, hey, let us show you our allergen room. And you walk in the allergen room and all the different allergens are just in there all mixed up and contacting each other, and it's dusty and it's a mess. And I say, oh, I see these are segregated from your non-allergens, but what are you doing to segregate types of allergens? And they say, wait, what? I have to do that? And I was shocked because as a food safety professional, to me, it seems obvious, but I have to remind myself it's not necessarily obvious. Don't assume that. You know, you really have to ensure that people understand segregation during storage, segregation during processing, and all of, you know, quality control. These are all required now in good manufacturing practices. Another point to make is that GMPs apply whether or not the other sections of that rule apply. Okay, so an example, I mentioned earlier in the presentation that companies that make 100% juice, they have a regulatory HACCP requirement, so they're not subject to preventive controls, but they are subject to GMPs. So even if you are someone that's regulated under seafood HACCP or juice HACCP, you still have to be compliant with these current good manufacturing practices. The term cross-contact is new. It specifically refers to allergens. So we used to call everything cross-contamination, but they've made a distinction. Cross-contamination implies, you know, filth or chemicals, something like that. Cross-contact, you know, allergens are a type of food. They may be desirable in some of our products and not desirable in others. So it's just contacting, it's not necessarily contaminating. One last point, and I will leave allergens alone. In the United States, may contain labeling is a hot topic, okay? A lot of companies I hear saying, you know, my product doesn't contain peanuts, but it's processed in a facility that also processes peanuts. Should I put that on my label? Well, it's up to you. You won't be penalized for it, but know that it does not offer you any protection in a court of law. So if you have on your cookies, say that, you know, these cookies are processed in a facility that also processes peanuts, and the cookie doesn't contain peanuts, but there are traces, and someone eats that cookie and has an allergic reaction to peanut, that cross-contact label is not going to protect you in the court of law in the United States. You can still be held liable for that allergic reaction. So it doesn't happen often, but I just want companies to understand that those cross-contact labels, they are probably just excluding consumers from you, and they're probably not really giving you the benefit that you're hoping for. The FDA's position is that cross-contact labeling should very rarely be used because GMPs should be in place and they should be effective to control cross-contact. Basically, in plain terms, why don't you clean better so that you don't have a cross-contact issue? I mean, in the real world, sometimes we have sanitary design issues. There's lots of reasons why we might wish to put a cross-contact label on our product, but just be aware of all the implications of that. Couple other changes, now non-food contact surfaces are addressed. It used to be only food contact surfaces were addressed. So now it's really important to note that non-food contact surfaces need to be cleaned as frequently as necessary so they don't become a source of contamination. That term, as frequently as necessary, when you write your programs, you don't write as necessary. You define what's necessary for you. If the FDA inspects, they're going to come in and they're going to say, oh, I agree with your assessment, or I don't agree because I see that it's dirty here and here and here. Okay. So you have to decide your frequency. You don't just write as necessary, because different employees are going to have different perceptions of what is necessary. Last change that I would like to highlight is shoulds and shalls. It used to be that we would have shoulds, which were recommendations, and shalls, which were requirements. Those words have been done away with. Now it's must, or it's gone. Okay, either those shoulds became requirements or they were removed. So there's no more shoulds and shalls. It's just strict requirements, and anything that's just a recommendation might be found in a guidance document or something like that, but it's not going to be in the regulation itself. Okay, enforcement discretion. The FDA has released a document, and it is linked in a later slide, that talks about practicing enforcement discretion. Basically, they've said, okay, we recognize that there's some confusion around these topics, and we're not going to enforce this unless it's a major public health issue. So, for example, the definition of the word farm, when I talked about the produce safety rule, I mentioned that it applies to farms. The definition of the word farm is under review, because currently the definition had all these things about, if the farm is owned 50% or more by the same entity that owns the, anyway, there were a lot of pushback, like, well, what does it matter if it's owned 50%, 49%, 51%? Who cares? Aren't they still doing the same activities? And the FDA was like, well, yeah, pretty much. So they are deciding whether or not they're going to change that definition. I think they probably are. And in the meantime, those companies to whom that definition applies are under enforcement discretion. So if they, would not be enforced upon with the new definition, they're not going to enforce on them now until they finally decide what they're going to do about that. Disclosure and assurance, there are provisions, all the supply chain requirements have provisions for disclosure and assurance. Like, say you're making a food for further processing. So say you're making a spice blend, but the spice blend isn't treated. It has to be used in cooked applications. So when you ship that food, you have to disclose to your customer that that spice is untreated. So in documents that go along with the shipment, you have to say, this product has not been processed to control, for example, salmonella. Well, then in that case, the entity that is receiving that product would know, okay, I need to cook this. And also they would need to ensure, previously the way the rule was written, they would need to ensure that they gave you written assurance that they were actually going to do that. So there was a lot of pushback from people that said, whoa, my supply chain is really complex and I don't know what everybody's going to do with my product. How am I supposed to get all these written assurances from everyone? And the FDA said, okay, so for now, we're going to practice enforcement discretion on the written assurance portion only. So that means you don't have to collect all those written assurances from your customers, but you do need to disclose if something you're making hasn't been treated to control a major hazard, something like salmonella, for example. So in that untreated spice example, you would still need to disclose that it had not been treated to control salmonella, but you wouldn't need to get anything in writing back from your customer. So another thing for FSVP, the way the law is written, originally it was absolutely going to apply to food contact substances. So that would include things like conveyor belts or, paddles that are used to mix. And companies were like, wow, that's crazy. If we have to do FSVPs for everything we bring in that could maybe contact the food, that's going to get excessive. So the FDA reviewed that and they agreed that that was a little bit excessive. So they are going to practice enforcement discretion on the food contact substances. So you still have to have an FSVP for foods, but when it comes to things like your conveyor belts or mixing paddles, even though technically the way the rule is written, it is covered, they're going to practice enforcement discretion on that for now. And then last but not least on this list, human food byproducts for use as animal food. There was basically, if you're sending the food for further processing, it is subject to this rule. If you were not sending it for further processing, like say the farmer was just coming and he was going to pick up all your old food and he was just going to throw it out to the pigs and he wasn't going to do anything with it first, he's just going to give it to the pigs. In that case, you didn't have to do much. You just had to practice some basic GMPs until you handed the food over. So what they've done is they've said, okay, when it comes to processing, what's processed and what's not, there's certain activities that have been deemed very low risk, things like drying or dehydrating to reduce the volume of the food, and those are not going to be considered further processing. So the companies would not need to comply with the preventive controls rules. So these explanations may be a little confusing, I'm sorry, but I have linked at a guidance document on a later slide that explains it a little better, a little more thoroughly. So I would encourage you, if you think any of these may apply to you, to go ahead and take a look at that guidance document that does cover all of these 4 different enforcement discretions for you. This slide talks about, this was released by the FDA. So every year there is an FSPCA annual conference, and they always have FDA people that present. And this was in this past year, 2018, in the summer, and they released numbers of the number of investigations that were planned for the next fiscal year. So the planned number of inspections for the different regulations is here. So for example, for preventive controls for human food, they plan to do 400 domestic inspections and 100 foreign inspections. For FSBP, they plan to do 2,275 inspections. That's a lot. That's a lot. Preventive controls in animal food, right now they're just doing good manufacturing practices inspections. So they're supposed to do 304 of those. And for sprouts, it's supposed to do 90 domestic and 1 foreign inspection of sprouts. So this information is always given out at this FSPCA conference. And again, on the next slide, I have linked where you can go, because after the conference, if you can't attend, you can download all the slides that are presented at the conference for free. So I usually go, but if I was not able to make it, it's very useful to be able to download those slides and look at all the information that's presented. I think it's interesting the number of importer inspections that are planned compared to the number of inspections for other rules. And this is because they're struggling really hard with people filling out that import paperwork incorrectly. And so they've increased the number of inspections for that rule because it's recognized that there's a lot of struggle with compliance. I think it has a lot to do with the fact that the training's not mandatory, so people are really flying blind. And so they've really increased the number of those inspections that are being performed on the importers. Remember, those are US-based companies, and that's by design. They want a door they can go knock on. They can say, hey, what's going on with this? Okay, so all those references I promised, here they are. The first link are the conference presentations. So that's where you can get, on the previous slide, all the number of planned inspections. The FDA's fiscal year runs from October 1st until September 30th. So that's planned for this fiscal year. It will reset again on October 1st. This year, the FSPCA conference is scheduled in October. I put a link for all FDA guidance documents there. And then specifically for the enforcement discretion guidance I mentioned. So those 4 enforcement discretion scenarios, they're all laid out in a little bit more detail in that third link. The technical assistance network is where there's a frequently asked questions section, and there is a section where you can submit your question if it's not answered in the FAQ. Highly recommend. I've used it many times. It's fantastic. Sometimes it takes a little while to get an answer back though. So if it's time sensitive, I would consult an attorney. There are 2 tools available online, which are very helpful for companies that don't have anything yet. There's a food safety plan builder tool and a food defense plan builder tool. I've used them both. They're both very good. Next link is a hazards guide. I mentioned that earlier when I said that if you're sending in finished products, you should make sure that all the hazards in the hazards guide have been addressed. That's the link where you would go to look up those hazards. There's a link for blank food safety plan forms. You can look at those and you can see those blank forms are pretty much almost exactly like your HACCP plan forms. So don't throw away your HACCP plan. There's a very good guidance document on bacterial pathogen growth and inactivation that's linked there. If you have any questions, please feel free to submit them and I would be happy to get back to you with answers. I know this presentation is very broad and it hit on a lot of topics. But if you have a question, we would be happy to help you out and find an answer for you. And if we don't know, we can maybe send you to someone who does. All right, thank you so much for your time. I will turn it back over to Ms. Jane Bowler.
Thanks, Erica. That concludes today's presentation.